everyone, it's Sarah Todd. Welcome back to my YouTube channel. Today's video is going to be on a bit of a heavy topic. I'm going to be covering medical trauma in this video. So if that is something that would be triggering for you, please do take care of yourself and your mental health and choose not to watch because you are much more important than watching this YouTube video. But if you choose to stay, I want to note that I'm going to be talking about medical experiences that did go wrong for me, but that medical trauma can develop even if medical experiences go the way they are supposed to go. So it's a very nuanced thing. Medical trauma can especially develop for kids because going through scary medical experiences when you're so young is a lot. And that was definitely the case for me. I developed medical trauma through experiences that went wrong, but also through experiences that went right. But in this video, I'm going to be highlighting the experiences that went wrong because there are a lot of them and they've definitely had a lasting impact on me. So I want to talk about those experiences and then share what has worked for me to get through my medical trauma. So let's get right on into things. So essentially, I've been dealing with medical trauma for the past 16 plus years. I'm 24 now. When I was 8, I became disabled, and that is where my medical trauma begins. So on April 19th, 2010, I became paralyzed from the neck down out of nowhere. We found out that it was from a neurological condition called acute flaccid myelitis, or AFM for short. It caused me to develop a spinal cord injury from C2 to T1. So when I became paralyzed, I was in the emergency room the day that this happened. I was there for 6 hours. I was sent home late at night because the doctor thought that I was making things up. He thought that I was faking things. And he told my parents, if she's not better in the morning, bring her back. So as y'all can imagine, that is like the main source of my medical trauma, but there are a lot of experiences within that experience itself that I want to talk about. So I remember being in the ER and I was lying down, and while I was lying down, the doctor picked up my right arm and held it above my head, and he let go of it. And since my arm did not hit my face when he let go of it, he said that I had control over it, so I was faking things. I also remember him bringing in a child life specialist. Child life specialists are supposed to be there to support children in the hospital, but this child life specialist did the opposite of that for me. She had a popsicle, and it was one of those popsicles that has a plastic sleeve around it, so they're very, very cold when you hold them. Before I became disabled, I would eat these as a child, and I would have to hold them with a hand towel wrapped around them because they were so cold. But when this child life specialist brought this popsicle in, she put it in my left hand, and she was trying to convince me to eat the popsicle. I couldn't even feel that it was cold because I did lose sensation for about 24 hours and then thankfully regained it back, but I couldn't even feel that it was cold. My mom kept telling her and the doctor that I couldn't feel that it was cold. And I also remember when she was trying to convince me to eat the popsicle, I kept saying that I couldn't move my arm, that I could not eat the popsicle. And the doctor would say that moving my arm was the ticket out of the ER. Basically, you know, trying to convince me to move my arm. I literally couldn't do it. So I was sent home from the hospital that night. They didn't even bring me a wheelchair, even though I couldn't walk. My parents literally had to ask for a wheelchair to be brought for us. So it was a horrible experience. And that's where the medical trauma begins, like I said, because what an awful experience that was. I did return to the hospital the next day because obviously I wasn't better in the morning. And I remained in the hospital for 2 months. And during that time, I definitely developed anxiety, but because I was 8 years old, I didn't know how to convey that. So I remember that I started having issues with swallowing, like while I was eating, it would feel like I couldn't get enough air, or like I couldn't swallow my food properly. And I never had issues with swallowing because of my paralysis. I never saw a speech therapist. I never needed to see a speech therapist. So this was a new problem. So they did an MRI and determined that everything was stable. Things were the same. So they ruled out physical causes of issues with swallowing through that MRI. But the swallowing issues persisted, and it was very much in a way of, like I said, I felt like I couldn't really get enough breath while I was eating. And looking back on that, I'm like, that was totally anxiety. Like, it was definitely not a physical issue. It went away once I got home from the hospital. So it was definitely anxiety, like kind of manifesting in this physical way. I also had trouble sleeping when I was in the hospital. I would have to hum myself to sleep. Like, that was the way that 8-year-old me chose to kind of deal with not being able to sleep, and it actually really worked for me. So they did a sleep study and didn't find any issues, but once those physical causes of swallowing issues and sleeping issues were ruled out, they never attempted to resolve the mental causes of those things. I was just left to deal with those on my own or, with the help of my parents. Like, medical professionals did not suggest any type of like counseling or psychiatry or psychology, anything like that. So I just had to deal with those on my own. And to that end, I remember also having a panic attack while I was in the hospital. I was in the hallway sitting in my wheelchair and my doctor was in front of me and I was crying and I kept saying that I couldn't breathe, And he said, "I know that you can breathe because you're talking, and that's how I know that you can breathe." And I think that he might have meant this to be reassuring. He was probably trying to comfort me and help me rationalize the situation, but instead it just felt very dismissive because I was like, yes, like I am talking, and so I guess I'm breathing, but I feel like I can't breathe. And nothing was done about that. Like, I was, once again, not given any mental counseling, psychiatry, psychology to help me deal with what I now as a 24-year-old know was a panic attack. So during my time in the hospital, my anxiety was definitely dismissed. And then when I left the hospital, another big medical trauma event that I remember was I was 9 years old. By this point, I can't catch myself really when I fall because I have remaining partial paralysis in my arms and hands. So if I'm gonna fall, like, I can't really break a fall. I was moving very quickly about my house and I tripped over a ledge where a door was and fell like on my face, and I got a really large gash in my chin. My parents took me to the ER and we were told that because it was a Friday night, nobody was going to see me or treat me. Looking back on that, I'm like, oh my gosh, like how absurd is that? Like, ERs are open 24/7. They don't close just because it's a Friday night. So my parents took me to another hospital where I was given stitches. I was given the treatment that I needed. But to be refused treatment, it was really just a flashback to everything that had happened on April 19th, 2010 when I was sent home. And these were two different hospitals that this happened at. So it was so shocking to have a very similar experience at a different hospital. A lot happened when I was 9, and I think that's because that was very shortly after I became disabled. So another thing that happened when I was 9 was I was getting my blood taken, and I was so scared of getting my blood drawn because I had to have that done a lot in the hospital, and so that experience just became very negative to me because of that. I was crying and I didn't know that I needed to do my best to stay still or else the needle could fall out. And so the needle fell out of my arm, and as a result, my blood spilled everywhere, spilled all over my dress, all over me, and it was a horrific experience. The nurse then had to get the blood out of my other arm. She had to try multiple times to get the blood out of my other arm. And yeah, from that point on, I was so scared of getting my blood taken because I was scared it was gonna spill on me. And I've really only recently been able to get blood draws again. I got my blood taken once when I was a teenager so that I could do a volunteer job, and it went well, but I was still pretty scared of it. I got blood taken again when I was a teenager for my spine surgery, and again, it was a good experience, but I was still pretty scared of it. And then last year I had to get a lot of blood tests done for various medical issues I was having, and I had multiple good experiences. So now I feel like I'm not that scared of it. It's just kind of something that's uncomfortable and that I don't look forward to, but I can do it. So I'm so happy that I've gotten to that point. It took me years to get there. Another story from when I was 9 years old. Again, like I said, a lot happened when I was 9. I needed to get an MRI of my brain and my cervical spine. I was doing this at an outpatient clinic. The entire experience took 12 hours because I needed to have an IV put in for contrast, and the nurses could not get the IV in. It took them 5 tries to get the IV in. And I know that sometimes, patients have difficult veins, that it's not always the nurse's fault. But when I was 9, this was like scarring for me because I was in so much pain from them trying to get the IV in. And so I became even more afraid of IVs from that experience than I already was. And it made the MRI experience take 12 hours because they could not get the IV in. And then at that same MRI experience, instead of just doing the MRI of my brain and my cervical spine, which was going to take 90 minutes, they did an MRI of my brain and entire spine, which took 4 hours. So I was in the MRI machine for 4 hours instead of 90 minutes. So yeah, that was a horrible experience. When I was a little bit older, I had another MRI and nothing went wrong exactly, but I wanted to avoid getting the IV because I was so scared of them after that horrible MRI experience. So they used a mask to put me to sleep and then put the IV in while I was asleep so that I could have the contrast I needed for the MRI. But when they were putting the mask over my face, it took me a long time to fall asleep, and the medical professional actually told my mom that like for some reason I was like kind of resistant to the medicine, that it took me longer to fall asleep than it really should have, and my whole body went paralyzed. Like I couldn't move anything when they were putting me to sleep. That was so terrifying. So now I would actually always take the IV over the mask because I would rather deal with the pain from the needle than feeling like I'm completely paralyzed again, because I know what it's like to actually be paralyzed from the neck down, and I never want to experience that feeling again. But yeah, fast forward to more recently, because I kind of took a break from dealing with a lot of medical things because it was so traumatic for me. So like once I turned 18, I kind of stopped doing a lot of medical things unless I absolutely had to do them. But I had a lot of medical issues last year, and a medical provider of mine ordered a lumbar puncture for me. Now, lumbar punctures are not easy to have done. They basically put a needle in your lower back and retrieve cerebrospinal fluid for testing, and it's a scary procedure. I had had one when I was 8 when everything first happened to me, but I don't remember it because since I lost sensation for 24 hours, I didn't even feel it. So I don't have trauma from having that done when I was 8, but I had this done when I was 23 last summer, and I was on a medicine that I thought might skew the results. So before I got the lumbar puncture done, I asked my provider if that medicine would skew the results, and she told me that it wouldn't. I was a bit skeptical because I thought it would, and that's why I asked, but I was like, okay, she prescribes this medicine all the time, she would know. So I got the lumbar puncture done. It showed everything was normal, and then I ended up seeing a different provider, and we talked about that lumbar puncture and the results, and she told me that I had the lumbar puncture done for no reason because the medicine I was on did in fact skew the results. So it was basically just like an unnecessary lumbar puncture because it wouldn't have told us any information that was actually helpful because I was on that medicine. And I was so mad because that lumbar puncture was a horrific experience. I was at the hospital for hours that day, and then I had a spinal headache for a week afterwards. So if I didn't need to have that done, I would have for sure not had that done. So I was so mad. I'm still so mad about that I did all that for no reason. So yeah, that's a lot of examples of medical trauma that I've been through the years. Most of it was when I was like 8, 9 years old, like right at the beginning of my disability journey, which makes sense. And I've only really been able to work through it very recently. All of the medical experiences that I had to endure from like 8 years old to like 18 years old were pretty traumatic because my memories of getting IVs put in, getting blood draws, getting MRIs were all from my childhood perspective. And so what I found has actually really helped me. Instead of avoiding getting things done, which I did do for a while, like I said, once I turned 18, I didn't really get anything done from like 18 years old to 23 years old, so I avoided it for a few years. So instead of avoiding things, what's been helpful for me is making myself do the hard things, realizing that I need to take care of my physical health, and making myself go for the blood draw, get the IV put in, get the MRI done, and then forming new memories of these experiences. So now that I've done all of these things, I've gotten blood draws, I've gotten IVs put in, I've gotten MRIs, I have adult perspectives of these experiences, and that's helped me to realize that they're not as scary, that like a lot of my memories were from, you know, that childhood perspective, so of course they're gonna be scarier. And I've had good experiences getting these things done. Other than the lumbar puncture, that was a recent medical trauma experience, but I've had good experiences with the IV, with the MRI, with the blood draw. So now I'm able to be like, okay, like it's not always gonna be scary and I can do it. Doesn't mean that I have to enjoy doing it, doesn't mean that I like it, it doesn't mean that I'm not scared or nervous, but I know that I can do it. And so I've worked through this medical trauma kind of on my own, and I have looked back on my memories of medical trauma when I was a kid, and I'm like, wow, I can't believe that all of those things actually happened, and that I kind of just like went through them and like went on with my life. So I'm letting myself in my brain work through these experiences and also talk about them with my counselor, and that's been so helpful. So yeah, honestly, props to exposure therapy, because that is really what has worked for me, is just putting myself in these scary experiences, doing it, forming new updated adult memories, and realizing that I can go through these experiences and that it's important to do that for my physical health, but that I can also take care of my mental health through counseling. So yeah, I think talking about medical trauma is super important to raise awareness of the fact that going through medical experiences can be terrifying, even if they're done properly, but especially when they are not done properly. And I think being vulnerable and talking about these experiences is important for others to realize that they're not alone, that these are unfortunately kind of common experiences. So it can be nice to know that we're in community with others who have gone through these things. And so I hope that this video was enlightening or helpful, or just made you feel less alone. And if so, please do consider giving it a like and subscribing to my channel. I post new long form YouTube videos every Monday at 12 p.m. Pacific time, 3 p.m. Eastern time, and I hope to see you all at the next video. Thank you all so much for listening and watching.